Lyme disease is a disease that was discovered relatively uh, recently, and it happened in 1975 in town of Lyme, Connecticut, and that's where the name came from. It's more prevalent in the Northeast and has become truly the most common tick-borne disease in the United States. So when Lyme disease is diagnosed, it's usually a consequence of tick bite, and tick actually does not cause the Lyme disease, but tick is a vector and a carrier of the Borrelia burgdorferi bacterium, and ticks can transmit Borrelia burgdorferi to humans. It can take relatively long time for bacteria to incubate. It can on average take from 3 to 32 days, but sometimes it may take several months. Bacteria can affect any organ and can cause variety of symptoms, can cause flu-like symptoms, constitutional symptoms such as chills, fever, malaise. Patient may develop arthralgias, but the most characteristic sign is the bullseye, which is a circle, reddened circle with a light colored center, and it will appear within days or weeks. So stages of Lyme disease, first of all, bullseye rash will appear, and it's very characteristic sign and circle with a lighter center. After that, patient may start developing cardiac and neurologic manifestations. At the second stage, patient may develop cardiac and neurological manifestations, and patient may have complaints of chest pain or even ribs, soreness, rib soreness, shortness of breath. Patient may complain of palpitation, may develop arrhythmias, cardiac blocks, murmurs, which may occur secondary to valvular prolapse. Certainly diagnostically, cardiac echocardiogram may be necessary in this case, and neurological symptoms may start as well. So twitching of the face, patient may have spontaneous tremors, Bell's palsy, development, facial paralysis, paresthesias, headaches, confusion, cognitive difficulties, difficulty concentrating, reading, poor short-term memory, disorientation. Multiple sclerosis is a disease of degeneration of myelin sheaths in central nervous system. It is the most common case of neurologic disability among young and middle-aged adults, and the typical onset is between ages 20 and 45. There is some genetic component in multiple sclerosis inheritance. However, there is no direct inheritance, but it's been suggested that for second and third degree relatives of person with multiple sclerosis are at increased risk of developing MS, and when we study twins, we see that there is 25% concordance rate if in monozygotic twins. when demyelination of subsequent degeneration of neurofibers in SNS happens, the patient may start experiencing symptoms. And what happened when the nerve is demyelinated, the nerve does not conduct electric signals properly and may have different conduction abnormalities. These abnormalities can measure by the tests, and it may measure the test may measure conduction velocity changes, decrease, or conduction block, and this may depend also on the place of the lesion and how long or how big is the lesion. Again, the abnormality of demyelination would happen. It's disappearing or slowing down the signal. And imagine that wire, electric wire that has isolation on it, that feeds your light bulb on your desk. The isolation was stripped and it lays in the water, very dangerous condition. Don't try it at home. But what happened, there's a chance that the electric signal don't get to the light bulb to light it up, and the signal, the electricity will be lost and will be conducted through the water. So same thing happens in multiple sclerosis. The signal either will slow down or completely will be blocked. So this is an autoimmune disorder, and the lymphocytic invasion of the lesion occurs when demyelination occurs. At the same time, lymphocytes may invade the lesions. So there is some type of evidence that there is antibody-mediated damage and to the myelin proteins, the proteins that build or that are vital parts of myelin. So when you look at the nerves, you will see hard or sclerotic patches, and you also would see in white matter that these patches are available, visible, and you don't need a microscope to see this. On autopsy, it's possible to see those, and myelin breakdown, you can see that those patches, and some call it plaque. They can appear anywhere in the brain, in brainstem, cerebellum, even spinal cord, white matter. If the plaque is fresh, you may see the evidence for active myelin breakdown. MRI is one of the ways to diagnose and evaluate for MS, and it may show two types of lesions or two stages of them. It may show that there is some inflammatory component, and that's the stage 1. And in second stage, the formation of the scar occurred of the demyelinated nerve. So basically the nerve's conduction again will be destroyed, and it will not be possible to conduct the signals normally. Clinically, what happens, the patient will again develop neurologic symptoms, will have speech and swallowing problems, visual problems because optic nerve is affected. There may be difficulties with gait, and There may be paresthesias again, disturbance of visual field, diplopia, and progressively patient may have worsening. So there are several types of multiple sclerosis. So relapsing, remitting form of the disease is characterized by episodes when patient will feel and will present with acutely worsening symptoms, and after that patient may have some relapses, fairly stable periods of time. Secondary progressive disease will involve a gradual deterioration, neurologic deterioration, and there may be or may not be relapses, but in secondary progressive disease, the relapses are not that common. And in primary progressive disease, there is continuous neurologic deterioration from the time that symptoms are started. So again, there are three types: relapsing, remitting. Patient may have episodes of acute worsening and then getting in stable plateau phase. Then after that, another worsening. There is secondary progressive disease, which is gradual worsening with possibility of relapses. And the third type is primary progressive disease, which is a continuous neurologic progressive worsening of the patient, unfortunately, from the time that symptoms started.